got a black dog. Always follow me around.
Welcome to some questions in nature. Today we're going to talk about some of the most common questions I get regarding CBD from both pet owners and veterinarians. The most common reasons that CBD is used in both people and pets is for arthritis-related pain. This makes sense because CBD is a potent anti-inflammatory and also inhibits perception of pain. There actually is good evidence for a lot of the effects of CBD, including double-blinded placebo-controlled studies for dogs with arthritis. The safety of CBD is a really common question I get from everybody. The easy answer is yes, CBD is very, very safe in dogs and cats and horses and probably every species we've looked at. Side effects are really, really uncommon. The most common uncommon side effect is typically a little bit of drowsiness, but that would be a really uncommon finding. Another side effect that we see with some strains of hemp and hence some CBD versions is increases in ALP, one of the liver enzymes. This is a really strain-specific phenomenon. We used to think that that was just part of the CBD world, but we know that some strains do not induce increases in ALP. The question about a pet getting high from CBD is really common. In general, the answer should be no. If the CBD is really coming from a hemp plant, that hemp should have less than 0.3% THC, which is really a very, very low dose. That should not make a dog or anybody get intoxicated or have a high. Typically, the published dose of CBD is around 2 milligrams per kilogram of body weight twice a day. That doesn't mean it's the only dose. One of the easiest ways to use CBD that I find is to start low and work our way up. What does that mean for my patients? That means we typically start at 1 milligram per kilogram twice a day, see how the patient does over 10 to 14 days. If the patient's comfortable or we're getting the desired effect at that point, then we either stick to that dose or see if we can use an even lower dose. There are a number of criteria that I would recommend when looking for a CBD product. The first thing I recommend is that it is domestically sourced. Domestically sourced can be important because in developing countries, hemp is typically used to help pull toxins out of the soil. So we don't want to get any of those toxins into us or any of our pets. The next important thing is looking for a reputable company. And what does that mean? That means companies that are developing products and testing them along the way. The important testing initially is with the oil when it's first extracted. That's when it should be tested for the cannabinoids, including CBD, and terpenes, which are responsible for aroma, and then all the things we don't want in the product, like heavy metals, pesticides, herbicides, mycotoxins, fecal matter, and organic matter. It's also then good to have that tested after the bottling to verify that what's on the label actually matches what's in the bottle. A lot of products that are in pet stores, gas stations, on the internet, Amazon, wherever, have unrealistically low doses. They tend not to be very concentrated, they have low doses, and that just makes their products look like they're more cost effective. But typically, if we ask those owners who have bought those cheaper, less concentrated products, they're not getting the effect that they want. So the idea is we need to use the right dose, and if it's a high concentration, then the volume of dosing is much lower. It is important to look at the cost per milligram because for a lot of products that look cheap, they're cheap because they don't have a lot of milligrams in them. And if we look at like how many cents per milligram you're actually paying for, it may be much higher than for a premium brand. CBD can safely be used with other medications. Typically, a medication that by itself could produce drowsiness may have more drowsiness if you add in CBD. If that happens, then we either need to lower the medication dose or lower the CBD dose. The reality is that that is pretty uncommon. If you look on the internet, you may see a lot of drug interactions, and these are really based on the human product Epidiolex, which is a CBD approved for children. The reason that there are so many side effects is the dose of CBD by itself is much, much higher in this product. And when you get really high doses, there truly are a number of potential side effects. If we look at that list, most of that list is related to anti-seizure medications. For the doses we use, we can actually use CBD in conjunction with anti-seizure medications to get a beneficial effect. There are no head-to-head comparisons between CBD and other drugs we use for arthritis, such as non-steroidal anti-inflammatory drugs. I think it just hasn't been around long enough for people to really do that, and I'm not sure anybody has the funding to really pull that off. There really aren't even that many comparisons between one anti-inflammatory and another, or one pain reliever and another. We do, however, have double-blinded placebo-controlled data for CBD and arthritis pain in dogs. We have other data in dogs, cats, and horses. So we just need to wait a little bit longer. There's more data coming out every week. The concept of when to start CBD is really a big open picture. The reality is the earlier you can implement it, the sooner you can get the effect. So a patient who has, say, early arthritis may really benefit from adding CBD, not only from potentially having more pain, but potentially being able to lower the dose of another drug or actually eliminate it so we have less side effects. As patients develop more advanced diseases, intervention sooner becomes even more important so we can offset side effects of other drugs and get better responses. I started Peak Therapeutics in 2017, and before that, about 2015 and 2016, as a pain management practitioner, I was really trying to incorporate hemp-based CBD in my practice. But I ran into three big problems. One, I found that companies were not very transparent in that they wouldn't actually tell me what was in the product. So that was a big no-go for me right away. The second was that some products didn't work at all. Now, I don't expect everything to work in every patient, but when it works in no patient, that's a no-go too. Then I had products that seemed to work, and then we'd order it again and get another batch, and then it didn't work. So based on the lack of efficacy, transparency, and consistency, I decided to do it on my own. Because of that, I then contacted the Colorado Hemp Farmers Association, asked them, like, how can I do this for myself? And here we are, 9 years later. Peak Therapeutics is a thriving CBD company for pets, horses, and humans. Peak Therapeutics has its own proprietary strain of hemp which produces our CBD. The reason that's important is a couple-fold. One, having our own strain means that no one else has the same genetics as our plant does. We have a very good profile in terms of terpenes and cannabinoids, and it would be hard to exactly duplicate that. The other thing is that our strain also seems to not produce elevated liver enzymes, especially ALP, as other strains do. Additionally, because we control our strain, we also control the farming, and really everything from seed to shelf. Some companies just buy oil on the open market, which means they're at the mercy of whatever strain they actually buy and whatever the profile happens to be. Thanks for joining me today. I'm glad that we could have this little chat, and stay tuned for more interesting topics and answers to your questions.